This is the fifth video in the series Quality Improvement Workshop, in which we will talk about 4 quality tools: Brainstorming, Affinity Diagram, Cause-Effect Diagram, and Datasheet. During the real workshop, we usually divide the trainees into groups and make hands-on practice on different tools. For more videos, visit my Facebook page, Healthcare Quality. The first tool is brainstorming, which is a creative group process used to generate multiple ideas in a minimum amount of time. It's a starting point for addressing issues and formulating solutions to problems. Process. It involves the active participation of all group members and facilitation by a group leader. The following steps can be used for effective brainstorming. 1. Define the subject. The group should be told up front that any idea is welcome, no matter how narrow or broad in scope, how serious or comical in nature. 2. Think briefly about the issue. Allow enough time for team members to gather their thoughts, but not enough time for detailed analysis. 3. Set a time limit. Agree on a time limit for the expression of ideas. There should be enough time for every member to make a contribution, but not so much time that the team prematurely analyze ideas. Depending on the size of the group, 10 to 20 minutes should be adequate. 4. Generate ideas. It's crucial that neither the leader nor the other group members comment on any given idea. Be sure to write down every idea as it is stated. If a wordy idea is summarized, make sure to check with the person who offered the idea to ensure that the summary reflects the person's intentions. Brainstorming might be structured or unstructured. In the structured brainstorming format, group members express ideas by taking turns in a predetermined order. The process continues in rotation until either time runs out or ideas are exhausted. A group member may pass his or her turn at any time. This method encourages participation from every member, but may result in a more pressured environment. In the unstructured format, group members voice ideas as they come to mind. This method is more relaxed, but unless carefully facilitated, it can lead to domination by more vocal members of the group. Clarify ideas. In this final step, the goal is to make sure that all ideas are recorded accurately and are understood by the group. There should be no attempt yet to rank or otherwise judge the ideas. The next tool is Affinity Diagram. These are designed to help teams organize large volumes of ideas or issues into meaningful groups. They provide structure and organization where disorder exists, and they can give new perspective to old problems. Process. Number 1. After brainstorming, record each idea about the issue on an index card or adhesive note. 2. Randomly display cards or notes. After all ideas are recorded, place the cards or notes on a wall or table so everyone can see them. 3. Sort in silence. Without talking, members of the team should sort the cards into groups of related topics. This should be done quickly without time for contemplation. Team members may rearrange a card but not discuss it. Sorting should continue in this manner until all cards are sorted and consensus is reached, which occurs when team members agree to leave all cards where they are. 4. Create header cards. Now discuss each grouping and create a title or header for it. Titles must be concise and make sense even out of context. The team may break large groupings into subgroups with subtitles. The fifth and final step is drawing the diagram. Using the identified groups as a reference, draw an affinity diagram. The next tool is cause-effect diagram, also called Ishikawa diagram or fishbone diagram because of their shape. Cause and effect diagrams are helpful in the improvement process. They show how two variables are related and is thus used to test for cause and effect relationships. These diagrams are designed to identify and display large numbers of possible causes for each outcome or problem that a team targets for improvement, such as equipment failures or medication errors. The undesirable outcome is shown as effect, and the related causes are shown as leading to or potentially leading to the said effect. Process. Number 1. Identify the outcome or problem statement. This statement defines the effect for which the team will identify possible causes. Place the outcome on the right side of the page, halfway down, and then draw an arrow horizontally across the page, pointing to the outcome. The arrow will focus attention on the outcome and provide the main axis of the diagram. Step 2. Determine general categories for the causes. Common categories include work methods, personnel, material, and equipment. Represent these on the diagram by connecting them with diagonal lines branching off from the main horizontal line. Teams have developed two lists that help them remember to consider these several classes of possible causes for a problem. These lists are characterized as 5 M's in manufacturing and 5 B's in services as follows: 5 M's: manpower, materials, methods, machines, and measurements. 5 P's: people, provisions, procedures, place, and patrons. Step 3. List major causes under the general categories. Brainstorm to come up with major causes. They should be more specific than the general categories, but may still have more specific subcauses. Team members should ask why or how at least 5 times. Place each main cause on a horizontal line connected to the appropriate diagonal line. This is a simple example of cause-effect diagram, in which the problem is lost control of car. The general categories for causes are slippery road, flat tire, mechanical failure, and driver errors. List subcauses and place them under the major causes. Not every major cause will have a subcause, but try to find any relevant causes that contribute to the major cause. Use smaller diagonal lines to connect them to the major cause. Here, for slippery road, possible causes are oil, ice, rain, and snow. For mechanical failure, we have stuck accelerator, broken tie rod, and barack failure that have 2 subclasses: worn pads or fluid loss. And for driver error, we have poor training, recklessness, or poor reflexes that might be due to chemically impaired or sleepy, as shown here. We could also use process steps as main categories, as shown in the following example. The main problem was that the patient records from visits to the emergency department at the hospital were not arrived on time at the individual medical office building in outlying towns where the patient went for follow-up care. The final step is evaluate the diagram. When all ideas have been noted, the team should study the diagram to determine obvious areas for improvement, causes that are readily solved or eliminated, and areas needing study so that they can be better understood. The next quality tool is datasheet, which is used to collect data needed for improvement. The datasheet is used to gather information about a quality problem. Specific bits of data are recorded in a simple tabular format and then analyzed by the project team. A typical datasheet to investigate delays in reporting laboratory results might look like the sample shown here. It tracks each lab order from the time the order is written until results are entered into the computer. As shown in this sheet, we record time for writing the order, drawing the sample, logging into lab computer, test completed, and time results are ready in computer. There is one compartment for main data like date, name of test, patient name, and room number, and one compartment for notes, besides instructions for use and question. Note that the sample data sheet is arranged for easy use and include clear instructions. It calls for information that can be used to test several sets of theories. For example, if the elapsed time from logging the test into the computer until the test is completed is short, the team could eliminate two theories: failure to follow first in first out procedure and analysis equipment problems. Usually, more than one set of data is needed to diagnose the root cause of a quality problem completely. Delay from blood drawn to computer entry can arise from a number of sources, so further diagnosis is required. Audit collected data. The team should audit the data as they are being collected to ensure that the specified procedures are being followed and that biases are not being introduced through the procedure being used as follows. Look at the results of any audit of the data collection phase. Is the number of observations collected the number specified? If not, why not? Do some comparative tabulation of the data itself. For example, do the cases collected by each data collector look on average about the same as those collected by others? Thank you.